Good morning, everyone. Thank you for attending our Joint Boards of Health and Hospitals meeting today, March 20th, 2025. It is 8:06. I'm going to call this meeting to order. Our first item of business is to approve our February 20th, 2025 Zoom video as our meeting minutes. Those, as always, are found on the city's YouTube channel. Do I have a motion?
So moved.
Thanks, Colleen. Do I have a second?
I second.
Thanks, Christopher. All those in favor of approving the February 20th Zoom video as minutes, please say aye.
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 Are there any nays? Are there any abstentions? All right, the motion passes and those minutes have been approved. The next item on our agenda is board education opportunities, which could be a number of different things. But the thing that I was thinking of when I put this down was in our last meeting, we were talking as a group about some of the areas that board members would like more information on, wanted to know specifically more about the behavioral health urgent care that is at SLU. And so that bureau has offered up time for a tour. And so in the email that I sent you all 2 days ago, I asked, one of the things that I asked was if people were available on April 25th in the afternoon. I know some of us are, but if you have not had a chance to look at your calendar, I will be following up after this meeting. So hopefully we can get that scheduled, and those who would like to take that tour can do that later next month. And Bo and Dr. Gary have been very lovely and helpful in trying to get this scheduled. So I thank them for being open to the tour and just for making the process easy. I also wanted to open it up to other areas that folks might have interest in or feel like you need a little bit more knowledge of in terms of how our public health team operates or some of the programs that they lead. And so I will just leave the next couple minutes as an open floor for people to share if there are areas that they think they or maybe our whole board needs a little more education on. I will share. I feel like I don't know enough about animal care. That's just an area of public health that I have that is new to me. I know that has been a focus area for Dr. Mati's team. So I don't know if it's a tour, but I think I would like to get a little bit more information, knowledge about the work and maybe some of the challenges that the animal care team faces.
Absolutely. It's hard to do a tour because they're out in community, usually responding to calls, chasing down dogs. We do have a partnership, as you know, with CareSTL, who oversees the shelter. I can inquire about the feasibility of opportunities to visit the shelter. But they're such an education-based bureau that I know that Allison, their supervisor, and Justin, their bureau chief, would be more than happy to also come to a meeting. They have a beautiful PowerPoint that they've done for the Board of Aldermen that really just go through what they do and how they do it. So if there's interest, we could start off with that. And I could inquire about the feasibility about either a visit to the shelter, or we can make their community outreach days available. There are times when they do opportunities for people to get to inquire about neutering or different things that they need to have done with their pets, and they'll do it in one community outreach event. So if any of that sounds interesting, we can definitely invite them to do the same presentation that they did that was very well received by Alderwoman Boyd and the Health and Human Services Committee on the Board of Aldermen. It was really beautifully done.
Yeah, I think that sounds like a wonderful place to start. I certainly don't want to disrupt the work that they do. I know the team is understaffed.
Oh no,
Um,
they're
but I
more
think,
than willing. I want to find the best way, so we'll do a
yeah,
back end when if you just let me know if you'd like it next month or which month they'll come, because it's ready to go. And
okay.
then after that, if there's also interest in for some like practical adventure type, I obviously visit Cara Steele. I don't think it would be an issue in the same way we're doing for the urgent care. So just let me know.
Thank you so much. Brittany, did you want to share the comment that you put in the chat?
Sure. I can't remember the name of it, but I was at Thomas Dunn Learning Center a couple weeks ago, and they were telling us about just randomly we saw a stray dog walking around, but they were saying that there was a mobile clinic that because there was an overpopulation of stray cats or feral cats, and so the mobile clinic will help and kind of neuter them, and then bring them to certain areas within the city that is stray cat land or feral cat land. And so I thought that was pretty cool. And I wanted to just, similar to you, April, after reading the report, I was just interested in wanting to learn more about that and didn't know something like that existed. Also didn't know it was a big problem either. So that's pretty cool to learn more about.
I love that. And they're always you're looking for community opportunities to partner. So if you have any information, please email it to me, Brittany, and I'll CC Allison and make her aware. That would actually be fantastic. Allison is a newer supervisor. When I came on, I always tell the story, and I can't get away with my little soapbox anymore, but poor Colleen and Emball probably have heard this 20,000 times, but there were 2 animal care and control officers. We now have a team of like 11, and we added a supervisor position because it didn't exist. And so Allison is just, all my leaders are great, but Allison is just is such a proactive, so passionate about this. And I think there has become a culture of community outreach. And so she has a listserv of partners that she meets with regularly. So if you send that information, I know she'll make time to meet with them and to see what we can do. And what I love about that idea, because I've never actually thought of this, so this is why this board is so important, is we have mobile vans, and I've thought about them for sort of your regular programming, never thought about them for use of animal control. And I think this could like really trigger some great ideas for animal and care and control to expand the community outreach they love. So you've planted a seed I had never thought about, and I pride myself in like, oh, we thought of that. Oh, we're doing that. Didn't do this. So if you could send the information, I would really appreciate it.
Dr. Mahdi and Ms. Jolly, if I could, that's my neighborhood. And so there is actually an apiary across the street from the recreation center that she's a beekeeper. She's also part of that feral cat effort. That is an effort that obviously the Department of Health is part of, but people in the community gather up and take care of cats. So there's a lot of feral cats that are in the wild, and they're going about, and somebody, we don't want to eliminate, they don't want to eliminate them. What they do is they take care of them. They continue to be wild. They clip one of their ears. And then as part of that, they spay and neuter so that it breaks that chain. And so we have fewer feral cats that are going around. But Thomas Dunn does part of that by making sure that the cats have some place to stay and recuperate after that operation. So it's a truly a community effort.
Thank you so much for sharing that. I never would have known any of this. So thank you, Brittany, for one, bringing it up, and for flagging that this is something that you have seen, and Craig for providing some additional context around what you know that is happening around this work. I do see one comment from Liz in the chat, and then also Colleen's hand is raised. Liz, since you put your comment in the chat first, would you like to share more about what you're curious about?
Yeah, so I'm always interested in this area. I got very into Alive and Well Communities years ago, and did a pretty deep dive there in terms of trauma-informed care, trauma-informed practices, and really making sure that the spaces that in particular kids are entering and educational spaces are actually meeting them where they're at. But in general, this is an area that I'm very interested in learning more about and what the organization does, especially when I see things around case management and doing kind of that wraparound care. I'm just very curious what that looks like. I am curious in the environmental health kind of space, more in that also, I was about to put this in the chat, but I'll just say it now. But really learning about kind of what does it look like when we're looking at almost like built spaces in neighborhoods, and trying to make sure that people have like healthy neighborhoods, if that makes sense. So they have easy access to the things that they need, but they're also an environment that I'm going to say feels more comfortable.
Thank
I'll
you.
quickly
so
respond before Colleen's question or comment. So happy to invite Bobby, the bureau chief, that we have a new manager who oversees both our family, community, and school health, and our CD Quinn as well. So Bobby could come visit. They do a lot of community outreach, and there's a couple of projects that once they kind of do a primer with you all here on the board, we could extend that opportunity, specifically a new maternal child health project around wraparound services and doula care, specifically for people who are expecting with Corridi House. And so that's a beautiful place to visit and to kind of see this innovative program in motion. So I'm as I'm sure April is taking notes, and she can assign which month, which bureau chief comes. And then for environmental health, while I usually center my team coming to talk about it, our team has limited opportunity to oversee every part of environmental health. That hasn't been a place that we've gotten a lot of funding and opportunities to. But Mayor Jones actually has brought in a national team that's looking at sustainability and access issues around healthier homes and how we configure that in St. Louis. I will actually see if they're available to come visit the board one day. We have a couple of people who are assigned to meet with them, and they're doing some really cool work around what I believe your question is, Liz. So I will look into them coming to visit too, and then liaise with April about the best time for that. Colleen.
Thanks. I am also wondering, in addition to sort of filling some of the knowledge gaps that we have, I'm also thinking about the new focus that we have on advocacy, and particularly in the funding landscape, and thinking about how exposure to some folks on the ground, like for example, at the HIV testing site, might actually best prepare us to be better advocates. The best stories come from the people who are doing the work on the ground. And so just as we're thinking about, how we want to interact with folks who are doing the work, prioritizing the bureaus and places where we think we're going to have to do the most advocacy might be one strategy, so that we have, impactful stories when we are doing that advocacy.
That is such a good point, and thank you for lifting that. Both the kind of areas that need the most support and help, and also it's always best to talk to folks who are doing the work to understand what the joys and the barriers and challenges are, of that work. So yes, we would be able to speak even more knowledgeably about the work that is happening, or what people wish could happen if they had the support that they needed with funding. I don't see any other hands raised, but tell me if I've missed someone, or if someone else would like to chime in or make a comment. And then I have a question for Dr. Monti.
I was able to get the PowerPoint presentation from the Zoom link I dropped. I don't know if anyone got a chance to watch that special ENA that the mayor did on the federal impacts. So I will forward that to you, April, for you to share with the board. Some people are audio learners, some people are more visual, and having that directly available may be helpful, especially in your advocacy efforts. So as Colleen was speaking, that PowerPoint I just asked for and just got it yesterday. So I'll make sure you all have it. And then I'll address some of the advocacy efforts that I've been a part of at the national stage in my departmental updates.
Thank you. I was going to ask you a question. Are there areas that we have not mentioned that you think we as a board need to hone in more?
Yeah, I think what this session that you so wisely put together to hear from people let me know is that, again, orientation was a while ago, and it's fast and furious, and it's early. I think resending out the orientation PowerPoint for folks to have at hand would be helpful. And then I also think the questions that were asked today showed, in general, a deeper dive into what we do, what you guys know we do, but a more deeper dive than like the one slide and maybe 3 minutes that the bureau chief gets during your orientation. So to me, it may be that based on this feedback, we make sure that you've seen one leader from each bureau throughout the year, so that it's like orientation on, superficial, everyone, deeper dive, and the opportunity to ask questions. And we can start with the bureaus that you all highlighted today. That was really my takeaway, and I don't have anything that I heard that I thought was a big miss. I'll think more about the administrative side, because you think about programmatic bureaus, but there's administrative leadership as well that may or may not be of interest to the board. I'll have to think a little bit deeper than that, but nothing comes to mind right now.
Okay. Well, thank you for always being open to hear what folks would like to learn more about, and just also for not being surface level. You always make sure that people get what they really need. So one of the reasons why you're a great leader.
Aw, don't make me cry on a Thursday morning.
Okay,
She
well,
lying,
thank you
she
for
ain't
that. Was that Christopher?
Yeah, but I was like, she ain't lying.
Okay, I'm going to move us along to our next topic, which is board advocacy and engagement. And I think the comment that Colleen just recently made is a really great area for us to be thinking about. But first, some folks were able to attend the meeting 2 weeks ago, I think, that Kristen held, just to kind of orient folks to some of the options in terms of how we as a board can start to organize ourselves. And my takeaway from all the conversations that we've had recently is that we really do need to form a task force. Like, this needs to be an area of focus. And for some of the areas of focus that people have an interest in terms of the strategy. We were thinking, Kristen and I were thinking that we could kick off a task force to address some potential key priorities, really talk about how we want to formulate a strategy, talking about relationship building. Thank you all for chiming in and filling out our matrix and thinking about allies to the work. And so I'm going to, after this meeting, send a doodle out to this group to see one, who is available the first week of April. I'll have several dates available and times. I've heard from some people that they definitely would like to be a part of a task force that's focused around this topic. That will, of course, remain open to all, but I do know that this is an area of passion for some folks more than others. And so we want to make sure that everyone who wants to lean into this work has the chance to, with whatever that might mean for you. So do I have agreement from the group that we will form a task force? The task force will be responsible for, I'll just say, drafting possible strategy and areas of focus for the board. And we might have to come back and talk a little bit more about the structure and the timing, because I'm not sure if this is time limited or if this is something that then morphs into a permanent committee, which we would then need to address in the bylaws, which we're also due to take a look at some point later in the year. Does that sound reasonable to this group? I see some nodding heads. Great.
Yes, yes.
All right, good. Okay, so as follow-up from this meeting, I'm taking notes. You all are definitely going to get a couple questions about dates. So dates both for an advocacy task force and for a tour of the behavioral health urgent care. A summary of the areas that people want to learn more about. And so people will have a chance to chime in if there's something that they thought of after the meeting. So that will help with agenda planning as we move forward with the rest of this year for the board. And I think so far, those are the main notes that I have captured that I need to put on my list as follow-ups. Are there other areas or other ways, aside from forming a task force and thinking about where and how board members can get to know the work on a more intimate level, that you all think we need to talk about? If not, that's fine. I'm sure that'll be an area for the task force. Okay. Hearing none, I'm going to go ahead and move us to our next agenda item, which is to hear from Dr. Mati about the department's proposed budget that she has been talking to is it the revenue office, the budget office?
Budget division, yeah.
Budget, yes.
Budget department, I'm sorry.
Thank you. All right, so I'm going to turn it over to you. And then there will be some time for question and answer after Dr. Mati has finished her presentation. Thank you.
Thanks so much, everyone. And again, great to see everyone. So a little bit of an overview again of how the budget process is handled in the city of St. Louis. And so we are asked to submit our budget in the first or second week of February every year. We're given a timeline each year. And so those dates are, a few days each, by a few days each year. In my department, that means the process starts as early as September. There was no infrastructure for this when I first came in. So I asked our commissioner, Victoria Anwuri, to work with our budget bureau chief, our fiscal chief, Emmanuel, to build a formal one. So we have put together a series of smart sheets, documents, and Excel spreadsheets that helps them to kind of prepare for what their budget looked like the former year and what their request will be. This is a very sort of detailed fiscal process, specific line items that are broken in two main topics, one being personnel and the other one being sort of the operational funds with line items for each. We then give them a period of time where they can meet with both Victoria and Emmanuel to talk about their needs. I also task them with sort of some aspirational goals, like where are you taking your bureau in the form next year? What's your strategic plan in that regards, and how can this budget empower you to do that? This year, because I have really grown this department and added a lot of new infrastructure and asked a lot of them, I actually asked them two questions. I want you to think about if this is going to be a growth year for you or a maintenance year. And I really made it clear that no one was better than the other. I think if you had been part of a growth year, it's so important to have a year where you basically tighten up and you're able to focus on maximizing all of these new things that you've brought together. But it's also those intangibles that people don't often prioritize in an organization that can make an organization sort of go backwards or start to become toxic, which is, how's the culture? How is, have you had time to really work on training? If you've really grown your bureau and it's basically brand spanking new, they're facing some of the challenges you all are right now, which is, they don't really know the ins and outs of the health department and things that the rest of the OGs and myself take for granted, right? And so that maintenance year in some ways was really important. And I love that I asked that question, because when they came back to us and we asked them, okay, is your budget focused on a growth year or on a maintenance year? It was easily 8 out of 10 picked maintenance. So that was, I was so glad that I kind of gave them that opportunity to think about what a maintenance year looks like. And you prepare a budget differently for a growth year versus a maintenance year. So I would say predominantly the department went through a maintenance year. So that went in the first week of January. We're then called within a month of that submission by the budget division, the mayors and leaders in the mayor's office, to basically be asked a series of questions. Did we make some errors? They don't understand why we put this or that. Where is this thing that they're looking for? And then it's basically radio silence until the end of May, while they make decisions independent of us about what the final budget will be. At that time, we are sent an email with what the decision has been made. And then we are required to present our budget before the Board of Aldermen for them to ask us questions. After that presentation, that's a live hearing that is open to the public. People can come in person or join along online. I cannot remember, Craig, if the public get an opportunity to ask questions at the budget meeting, but I do know that they're able to view it. They can't ask.
It's up to the chair, but it's up to the chair.
Okay. After that, the Board of E&A then votes on the final budget for the year. This happens very quickly. Typically, sometimes we've gotten that letter within days or a week of us having to present to the budget committee, which is suboptimal. because we're asked to present something that we actually don't know. It's just been assigned to us. So that is the busiest time for my team, is basically processing the budget, going through it, kind of figuring out what we got, and then trying to put that in presentation format for the Board of Aldermen. That's all happens around in June, and then July 1st, they activate our new budget. So any questions about the process or timeline before I present to you what our priorities are for this year?
Will we get like a notification of the dates of that, or is that like sent online?
So that's all online, and it's not really made publicly available because, again, it's variable. But if you're asking about the date for the Board of Aldermen presentation, the one that I said was
Yes.
public, that is made available online through the Board of Aldermen. And
Gotcha.
again, Chris, we never know what those dates are ahead of time.
Gotcha.
We're just kind of told within days, like, you need to be here on a Tuesday, or you need to be here on this Wednesday, or, sometimes we get a week notice. That's a luxury. So once we know, I'll definitely make sure the board knows. But if this is something that's important to members of the board or the board as a whole, I would make sure that someone is assigned sort of checking. I sent a document with links to different websites that I think would be helpful to y'all. I don't know if that's been circulated yet, but in that is the sort of Board of Aldermen's website, and you can find the budget committee's site, and that hopefully they will make, not hopefully, they do then make those hearings available once they've decided them.
Gotcha. Okay.
But I'll do a good job, Chris, of highlighting kind of like a month before. Just remember with the, next month will be the month that I'll likely be called before the Board of Aldermen. So if you're looking for those dates, it's a good time to start looking now. I can do that as well.
Okay. Thank you.
Absolutely. All right, let's talk about what I present. So I present a very detailed budget. There's an online format where Emmanuel has to put in every single person in the health department, their salaries, line items individually. It's a very onerous task, and he and his team are to be commended for the amount of work they do. He as an individual just has to put this in, and it takes him a long time, about a week to do, sometimes longer. Then I also have put together a memo that kind of describes our priorities so that it's not just numbers and cents, and they understand what our priorities are. So I'm basically going to present to you from that memo this morning. So the first thing that we said is that, we really are focused on advancing our vision of St. Louis an equitable community, achieving optimal health for all. Our top priorities for this fiscal year are focusing on our animal care and control provisions, especially sheltering our, strengthening our shelter operations. You have heard me talk a lot here about the challenges there within around the quality of the building that we're in, and we've been advocating to the mayor's office for a new building. This board has been a big part of advocacy packets, and we hope that that will be seen favorably this year. And just shelter operations in general. We get a lot of feedback from other shelters and from city constituents about what that looks like. So we have asked for support there. The second, that's the main part of our budget. For the most significant new area where we're asking for an additional $1,350,000 is to strengthen those shelter operations for the city of St. Louis. The second part, and then we go through bureaus and we basically just tell them what has been going on. So one area that's newer to the budget, it was newer last year, was the inmate medical budget. And we were responsible for coming in an emergency basis at the end of 2023, and the first year of us having oversight and evaluation over medical care services in the city jail was 2024. So we've had a full year now, and in order for me to ensure that medical services continued for the city jail, I was asked to come in and do that oversight process in about September actually of 2023. The subcontractor that the city was suing, and they provided notice that they would be out by the end of November. So I basically had 2 months to secure a new medical provider, which is unheard of. So I reached out to the national entity that oversees medical medical for jails at the national level and kind of sets the standards for medical care in jail settings, the NCCHC, and asked for a recommendation. And I went into an emergency contract in less than 2 months. I still can't believe we achieved that. And so because that was an emergency contract, we needed to put a formal RFP out for the long-term contract. That was what we were working on last year. And we asked for money to basically, people can ask for more money during an RFP process. And so the emergency provider that we went with, PCUSA, negotiated a new contract, and our budget reflects asking for the difference there, as well as for all of the things that we need to do that oversight role. And so that requires personnel, that requires training, that requires data reporting. And so that's also reflected in our requests for the budget in different line items. So then the budget is split into different, the budget is, different parts of the budget are assigned numbers. So for example, my budget, the director's budget is 700. We have a healthcare trust, which is 70002. The inmate medical I just talked about is 70020, for example, and so on and so forth. And so I then talk about each part and where there are a little bit of a variance. So I'll talk about personnel first. We are requesting 33 new positions in next year's budget. Most of a lot of those have to do with supporting the shelter services that I talked about. That's the #1 priority for this year's new budget. So we have some positions there that we've asked for. The rest of those are split between bureaus, and I'll talk about a few of them as I go through bureau by bureau. So in the director's budget, I asked for some utility workers that we requested last year that were not put into the budget, but that we've subsequently been able to hire. So it was just sort of a correction, as it were, because we need utility drivers to drive those 2 mobile vans that I've spoken to you about that really are the backbone of our community outreach and access efforts. We were asking for them to correct 2 other things in that budget as well. New positions that we asked for were mostly in the inmate. We are asking for some secretarial support. We built that team out. There was only 1 person when we first started last year. The team is now up to 4, and they are doing a lot around recidivism, those oversight and evaluation, data acquisition, and they just need some administrative support. So we asked for a secretary there. In the commissioner's budget, we are really doing a lot around quality improvement. Every year, we've actually asked for a whole quality improvement bureau. So if you think about our accreditation efforts, those were done previously by 1 person, and we were always at risk in the past of not being accredited. We are accredited without correction or a corrective action plan, which was completely unexpected by us. It is to the credit of this team and the subcontractor. Subcontractors cost a lot of money, and we could do this work in-house, right? Also, every department, most of all, like public health department, should have a quality improvement culture. And so a lot of our abilities, a lot of the requirements for us to be accredited and to stay accredited are all around QI. QI projects, strategic plans are required. We're supposed to measure and have performance management systems. So we have not gotten that bureau approved in the budget in the 2 last cycles. So this year we asked for key positions to at least start to build a bureau. So government services analysts, folks that can do the work of employee education and engagement, which is a big part of, my leadership style around the culture of the bureau. And then we asked for a FAB, which is the accreditation bureau and planning person as well in the new budget, as well as a manager to help to support those efforts. Then in our programmatic bureaus, most of them, like I said, were in the maintenance year. So the requests were very minimal. We were, the communicable diseases looking for some public health program specialist, animal care and control. I told you had the bulk of the positions around the shelter. In environmental health, we did not make any changes. Actually, they're really hunkering down on the maintenance stage. And then in family, community, and school health, we really talked about our priority in maternal child health and the doula program that we talked about. And so to support those efforts, we asked for 3 new community health worker positions, as well as a public health educator for our school programs to sustain the work that we're doing. Currently, we only have 1 nurse that liaises with all of the schools in the city. Outrageous. And so we would like to build a team around that, and that's why we asked for that position. So I will stop there. It's a lot of kind of listing, but if I were to summarize, overall, the department is in a mostly maintenance phase. We are prioritizing our new initiatives or support and requests around the animal shelter, around our quality improvement efforts, and around our maternal child health priority. But I will stop there and take any questions.
Thank you so much. I do have a question about the asks that you're making for staffing, and what are the benchmarks or maybe the standards that you're using to kind of set what your baseline should be regarding the staff that you're asking for?
That's a great question. We currently have not had the infrastructure, I would say, to have a model that sort of allows us to look at industry standards. The easier way that we do is that the state will often set what the minimum requirements for a bureau for a city X large. You can find that sort of research. So I did that research very earlier on in my tenure, and we were so woefully behind. This department, as you've heard me say, is 4 to 5 times smaller, the size that it should be for a city this size. To put it in context, the county's health department is 5 times larger than mine, and their budget is 5 to 6 times larger than mine. So we know we're operating at a deficit across the board. We also know that and I've tried this, I've tried to come and say, hey, I came with a budget and I looked at industry standards and for public health, and I was laughed out of the budget. My first, I'll never forget my first budget meeting with the budget director. He laughed. He was like, there isn't enough money like this. There isn't enough money in the city for us to give you your ask, regardless of whether they're industry standards. So honestly, I'm just April, I'm just chipping away at what we've known since 2021 we need, and the vast gap of what we are from industry standards. However, because that has not been good enough for me, so you know that I've started to build in, under my leadership, we never had like a formal performance management system, and we certainly didn't have KPIs of any measure. So we built what I think was a very foundational and simplistic performance management system. Thankfully, it was shined upon favorably by FAB, but we are currently in subcontract with 2 entities that are helping us to build KPIs and evaluation models that will build the types of benchmarks that I believe you're referring to. But right now, it is taking what I was left out of the budget committee budget meetings in 2021 and basically trying to play catch up with something that, if I'm being honest, has been we've been behind on public health standards for over a decade. Most of all, the clearest question that I would expect is, why don't we have clinical services? I have a new manager who went to take a meeting at the county and came back like he wanted to cry. He was like, I parked my car in a building that is just for public health. Let's start there. They have an entire building. When you walk in, if you want to do admin, you go to the left, but you can turn right and get clinical services. So the biggest gap, right, that would cost a lot of money and a great investment is the fact that we have no clinical services, except for a little bit of STI screening and a little bit of TB for migrant and immigrant health. So it's so hard to answer that question seriously because the gaps are so wide, and trying to overcome that chasm is the challenge. And I'm welcome to any feedback.
Well, thank you for answering that question with the realness that you always bring. And I didn't ask about clinical services because I already get what the situation is.
You were like, let me not trigger this lady.
I guess so that then kind of has me thinking of another question around, given you do not manage many clinical services, and I guess maybe it's a comment, not a question. I would guess your KPIs and your benchmarks will look a bit different than the KPIs and benchmarks that perhaps your colleagues in the county might have.
Oh my God, I love that comment so much because I don't think people appreciate how this health department is often left out of conversations, because why would anyone invite us to meetings that are happening regionally in the city at the state level around clinical care, right? People have CMOs. Why would I have a CMO? People are talking to, and those are meetings that we are kept out of because we don't have clinical services. And it makes it difficult for me as a director of health to very seriously lead the health of individuals when we are not engaged in clinical care. This is a huge gap. So I have made proposals. When ARPA came, I made a proposal for what this could look like for the RAMS money. And to be fair to the administration, there was an inclusive process across the city, and health didn't feature as a priority for people. It didn't come up in the community participatory approach. So it's hard to make people understand that something should be a priority that they're not getting. And people are just used to not considering us in this avenue, and that has to change. So I'm fighting for that. So the subcontractors I have that are basically giving us a plan around KPIs and different things, I want to be able to build a business plan for what it would look like to incrementally, in a way the city could sustain, bring back clinical services, because this should not be subject to a vote or a debate. This is a foundational human need, is the need to be able to gain clinical services from your city government. That it's wild that this is something that I have to sort of argue for and explain, but that's where we are. It's been gone for so long that when you have these things, when people are like, we have this unprecedented pot of money, what do you want to do with it? To be fair, health didn't feature as a priority, right? So it makes it difficult for me to make the argument to the mayor's office, to the board of aldermen, to say, why isn't health there? And they'll say, well, we asked people and they didn't ask for it, is basically the answer.
Thank you. Colleen, I believe I saw your hand raised.
Maybe Dr. Mahdi just answered it, but I was wondering if someone could share a little bit. Since I've been involved, there have been no clinical services. So I was wondering if there was a time when there was clinical services and what happened to sort of transition to that space.
All the
And then,
greatest questions. Craig
Yeah.
Schmidt, you probably know more about this than I do, because this preceded me even living in the city. But we did have clinical services. It's been almost a decade, if not more now, that they were sunsetted out. Craig, can you give a little bit of historical context here?
Yeah, it would be a long story, but so there is a story about partly why folks don't trust government. So Homer G. Phillips was, as everybody knows, the teaching hospital for African Americans. It was nationally known. It was closed by the city. There's a whole host of reasons. Some may be good, some may not be. 1979, I think that was. And then there was the other hospital, named after one of the early Max Starkloff, that was closed as well. They went into various efforts with regional and some other things to try to bring folks together with disproportionate share payments from various hospitals. The latest then was the 1115 waiver for Medicaid, which this department contributed to, and so forth. So the long and short is, and then there were some hospital services which Rhonda would be very familiar with because she was in the lab. We had a building that was right across, basically, or right up in the entertainment district, theater district. It's now On God Hotel there across from St. Louis University. And so there were services that were provided in, I don't know, is that a 10-story building or something like that? Michelle was there, but we've essentially abandoned the public from providing those services on the basis that we couldn't afford to do it and that government should get out of it. So that's my take.
About how long ago was that?
Oh my God, I'm trying to remember. So there was regional and so forth that came into play. So they came here into 1520. Rhonda's probably a better judge of that. I'm thinking like 2009 or so.
Yeah.
It's been a long time.
Yeah, I was like, didn't regional close in, yeah, either 2009 or 2010, and then Connect Care kind of, I guess, formed to provide the outpatient care, which then transitioned into the Regional Health Commission, creating more access with federally qualified health centers.
Right.
And with St. Louis County
And
Department
IHN.
of
Yep.
Health. Yeah. But yeah, there have not been services in the city for quite a while. And then I don't know what the process was either of kind of ramping the services down. So it could have even felt like there weren't really services prior to the actual end, depending on how long it took to end some of those services. But when people are seeking, when people who especially are low income or who don't otherwise would not otherwise have access to safety net services, they are most likely going to find access at a federally qualified health center or an emergency room.
So if I'm catching this right, basically it was a budget type of topic from why they didn't add the clinical services. Correct?
Not really.
I think it's a very convoluted conversation that's happened over, if Craig talks about the closing of this around 2009, 2010, I mean, this is 15 years old, Chris. And I think at the time there were probably valid conversations and some very invalid ones as to why people didn't think through this well. And then bringing it back would be a multi-million dollar endeavor. And right now, and again, I've always made the argument that the best time that should have been thought about and maybe a commitment to some sort of plan would have been around ARPA and around the RAMS money, but those are community participatory approaches and nobody was checking for health. In fact, during ARPA, more money was given to the FQHCs discreetly than this health department independently, which also says a lot as well. And so I think that my goal is to help the city think of a strategic plan to get there that will obviously take time, because now with things like state takeover of police, which is going to cost the city money, the federal environment right now where a lot of cuts are coming, and that's going to cost the city money. I don't know that this would be the time for me to stand on my very valid soapbox and say, what about clinical services? You know what I mean? And a big fat paycheck. I think my strategy now is to do it incrementally, maybe have a pilot clinic around this priority area, show the success of that, allow that to build over time, maybe the way to do it. Or there's a lot of hospitals that have closed down even under my tenure. St. Alexis, Homer G just closed down this week. That's not great for the city either. And so there could be a time where the city could really think about, in a serious way, is this a great opportunity for us to partner with X to bring back a city-led hospital that would over time generate income? If you look at San Francisco, they don't even come to the city for their budget. None of their budget is out of general revenue because they operate on the profits of their city-run hospital. That to me would be the goal. And they have one of the biggest public health departments in the country as a result. And Bell's had her hand up for a while, so.
Thanks, Dr. Monti. I just wanted to add that there was a ramp down and one of the resources and skills that the health department still provided in 2008-9 included things like STD testing, and then that was cut by the previous director, or a prior director. So I think that it all comes at a time. I'm happy to think about the way you're looking at this too, Matthew, is really looking at the like long-term, how we can strategize to bring this back and understand what it is that people need, because we've really taken the government work out of the government so often, and then expect them to have those outcomes to still improve health, but not actually let you do any of the work that would require that. So I think now is probably not the ideal time politically, but I think if the right person, if there's ever going to be a person to fight this, it is you, and we are right behind you. So thank you.
I really love that comment, Colleen, and the timing couldn't be worse. And I hate that I'm becoming frustrated that we keep having to push back public health. It's always, it's a pandemic, it's not a good time. It's this, it's not a good time. And I'm like, you know what? I'm just going to have to do it regardless of whether it's a good time. Health is always here. Like, what are we saying, right? So I get it, but it's not my folks that people are acting a plum fool at the federal level. We still need health, right? So it isn't a good time, and we have to have the conversations. I think we did a survey the last time we did, we did the CHA as part of the process. I'd be interested in your feedback around maybe my Epi Bureau and my Comms Bureau working together on a very simplistic, and really like we would push the timing on it to get a really robust response. Like, I don't know. I'd love to see if people understand the disconnect, and what do you expect from a director of health if you're not supporting for clinical services? Like, do you expect clinical services from your health department? And if the answer is no, then what do you expect from your director of health, right? Is it that I have an oversight role over hospitals and FQHCs? And people have to be realistic about that. Why would a private entity like WashU expect that they owe me any sort of, why would SSM or WashU expect that they owe me anything? That's not codified into law, that they that I have any sort of enforcement arm towards my role. So really, what is that role? What do you expect from this role and this department? And then I think that will help us sort of help people understand what's needed in order for their expectations to be met. Maybe, but I don't know.
Are there any other questions? I do see in the chat, Tyrell Manning has added that people do come expecting and seeking clinical services, and it's hard sending them to other spaces. Yeah. So.
I love that comment. And for those of you who don't know Tyrell, I don't know if you're in a position to unmute and just introduce yourself and talk about which clinic that you are referring to in your comment.
Yeah, sorry. Hello, everybody. So I am the program manager for the HIV and STI prevention program. And so I get the honor of leading our Health Stop clinic. And so you can go to healthstopstl.org, shameless plug, follow us on Twitter, healthstopstl. And so it is like one of the, like we have our TB clinic, which is housed at Affinia, but we're housed here at the health department on the first floor. And I think it's probably been 2 or 3 years, maybe 3, 4 years, somewhere around where it's been reopened, because they did not exist. And so I think the previous director really fought to like get it open again, but it's very hard to lead the clinic where people are coming to us and we can test them, but luckily we have partners that we can send them to, but often people leave very frustrated because it's like, I came here to get tested. Why can't I also get a treatment here? But then, again, we are grateful for our partners, but I think it would just expand our services. I think even when we use our mobile unit, being able to treat people like on site on the mobile unit. And so that's something that I have like tried to advocate for since I've been here. I'm grateful for a director that advocates in alignment with that. And I know that's going to happen. We have bought the tools to prepare for that. We have kidney machines to hopefully connect people to PrEP in the future. And we're constantly thinking of ways to reset the clinic to prepare to actually receive those clinical services, but because it's vital, like it's very important for the work that we do. And yeah, so I'm just grateful to hear this conversation. I'm never actually supposed to like, these calls are not required. This is actually a meeting that I really enjoy. So I like coming here. That's all.
Um, Everything about how Tyrell showed up just tells you about his leadership. This is one of our easily our most successful programs. I'd love to invite him back. He's done some innovative things that this region hasn't seen before. Recently had one of the most prolific and transformational calls to talk to Black women about their sexual health and HIV needs. And he is just a visionary here and a huge advocate for public health, especially around HIV, STI, as well. And so I think his comment is so important because when you talk about social and structural determinants of health, the fact that people are coming now, we've opened this clinic, he's increased the numbers in droves that come, and they come because Tyrell and his team are now the trusted messengers in this space in the city, and they expect that they've taken walked to take a bus, to take a train to get here, and then they're told, hey, we tested you, but we'll have to send you to these different partners across the region. We can't assure how soon you'll be seen. That speaks against every single tenet of like public health and eliminating access and barriers to health. And so such an amazing on the spot experience. And then the fact that he just nerds out and is like, I don't have to come to these meetings, but I'm here every week. I don't know if you see, he's always off camera, but he's always here. So
But
a huge leader in our community. Thank you, Tyrell.
I'll also add just quickly because we expanded our Take Me Home program, which was previously just rapid oral swab for HIV that people could order at home for free. But now, the last month, we've expanded it to include STI testing. And so, Dr. Mahdi has a message coming to her, not for me, but it's from me. But like, we're getting those reports back of people ordering. And I'm like, well, if we get a positive, again, I have to refer people out, into another space instead of saying, hey, your health department is available to offer you that treatment. And so let's continue to fight for those clinical services.
Thank you for all the work that you are doing and leading and the way in which you are doing it.
Thank you.
Did I see someone else's hand raised briefly? That maybe they took it down. Well, it sounds like, well, one, thank you so much for this overview of the budget and for the dialogue that it has led to, because I think this also points obviously to areas that the task force can be thinking about. I think since we only have about 20 minutes left in this meeting, and I want to make sure that Dr. Mahdi can offer up any other updates that you have, I'm going to move us along to the departmental updates section of the meeting.
Thank you so much. I'm going to share screen and give you a preview, as always, of what's coming to you within the next 24 hours or more around, today or tomorrow. I don't know why I was so dramatic about that. Today or tomorrow around the St. Louis Department of Health. Do we not love this cover photo? One of my favorite games is waiting to see what Erin is going to do with the cover for the monthly report. Last year was all ice and snow, and spring is here today, actually. And then it decided to be 35 degrees when we wake up, but welcome to the Lou. My favorite thing, and I want everybody locked in, is that who is doing the greeting today is the Commissioner of Health, not me. You don't have to hear from me for once. So she is going to be talking to you, and talking to you in the intro. Please, please read this because she is introducing you to a program that she envisioned, came up with, advocated for, and has implemented. One of the only program of its kind in the city currently. We're the first department to do something like this. It speaks to her innovation, her leadership, her passion for public health. It just gives you an idea as to why she loves this work so much. And so you'll be reading about the department and the city's first ever tuition reimbursement plan. And when I talk about the fact that this department has grown by over 35% in less than 4 years, it is because we focus on retention, not just recruitment. One of my pet peeves is, you know me, because I've been subject to this as a minority and a woman and an immigrant in this country, is that people love to be like, come to work for us. And then when you get there, it's like nothing, no awareness of what it's like to work in these spaces. So retention is a big part of that. And her tuition reimbursement program is just incredible. So she'll be talking to you about that. We have community impacts. I want to shout out Brittany, who took my feedback at the last board meeting and asking for tangible feedback around the annual report. She sent the most thoughtful email giving us feedback. And one of the things she asked for was more stories from community. So you will start to see the beginnings of that, Brittany. We know it needs to be more of a storytelling and maybe honed in on partners, but we need time to collect those stories. But you're going to see one revamped and one new slide based on your feedback, Brittany. So your leadership is so important. And so community impacts, the biggest one was my meetings. I traveled to DC, to Capitol Hill. I'm not gonna lie, I was anxious about this time. Last year, it was all nice, warm and fuzzy, meeting with the Congressional Black Caucus. This year, the federal climate has been challenging. And so I didn't know how we'd be met. I met with a couple of offices, and I'll just talk to you a little bit about those now. So the Senate Majority Leader's Office, the Senate Finance Committee, both majority and minority offices, the House Ways and Means Committee Majority Office, Speaker Mike Johnson's office, and then Representative Richard Neal's office as well. You know, when you show up the way I do, you just don't know how that's going to go. And I'm very grateful that everybody had decorum and were professional and we were heard. What that translates to. So my goals for those meetings were to make clear what I think, what are the public health priorities and threats that keep me up at night right now as the director of health of a major city. I then talked about funding. I talked about workforce development. We talked about the need for research based on this substantial NIH cuts and more that are coming around research. And then the need for clear, transparent communication from people with actual public health and medical expertise. Those were sort of the main markers. We had examples, we had an advocacy packet that this department may be one of the few in the country that have been able to get into these types of offices and have packets ready with clear feedback examples. We also had bills that we were supporting that a number of medical organizations, but specifically the Infectious Diseases Society of America, are putting forward around workforce for infectious diseases and public health and around antimicrobial resistance. So we talked about those in those meetings as well. I thought it was great because usually I feel like I'm going to support the priorities of St. Louis and national public health priorities. This time I also wanted to data gather and get a lot of feedback about what we can be doing. So you'll be hearing more around what I believe should be regional and state level public health advocacy priorities. And it's a great time because this board is engaging in that. So would love to have a conversation at a future board meeting or come visit one of the task force meetings to talk about what advocacy can look like right here where we are. Being clear about what the public needs around public health in St. Louis and in the state of Missouri, and who we should be meeting with and how we should be addressing those advocacy efforts. You can see some of the other community impacts here. Good news, you have seen the high for influenza every time. We've just dropped to the moderate range, so you can read more about that. Every bureau, as usual, is going to be showing you things. And I'm so proud of Erin and Shantae and the team because they really want to now get back to the monthly report of teaching. So you're going to have topics that you may not know a lot about, and we're going to be teaching you. So one of the ones I want to highlight is in the communicable disease section. What is latent TB? After the Kansas City TB outbreak, there's been a lot of misinformation and disinformation and panic in the public. So in your monthly report, we're not only teaching you, but we're empowering you with language on what to tell people around TB. There's only been one new TB case in the city in the last month, so there's no reason for alarm. We're not in outbreak territory, but we also explain why people get confused about latent versus active TB. So there's information there as well. The usual programmatic updates there. Really want to shout out our employee spotlight this month, who is a 30-year of service employee, Carlotta Blair, who works in our new, never existed before I was director and before commissioner and Worry came to build out an office of contract management. You've often heard me say that we do a lot of contracting and subcontracting. This was down to one person. And to show you the value of her work, this was a one-man job when I came. She now oversees 3 people and has a boss above her for the same work she used to do alone. And so we really are celebrating 30 years of service to Carlotta, telling you all that she does, and telling you a little bit about what she enjoys about her work and outside of the department as well, which includes writing poetry, growing plants, singing, and her favorite music genres are gospel, blues, and R&B. She loves being a glamma too. Doesn't look like one, but she is a wonderful glamma as well. You can see that the team has updated the monthly report to give you a QR code that makes it easy for you to promote the positions we have. This is where I'm asking for homework. Look at all these positions I have. They span nurses, administrative support, public health program representatives. Really, there are so many opportunities for people from different backgrounds here. You no longer have to live in the city to work for the city. The process is all online, and we give you a quick, easy QR code to get to it. So if you could please use your listservs, that's your one homework. And I would like people to BCC me on the emails they sent out, so for proof and for me to celebrate at next month's board meeting of how they circulated these employment opportunities. And then again, to Brittany's feedback, this is going to grow out to more of a storytelling page, but some of the noteworthy moments we had with our partners, Brittany talked about how lovely it would be to see our partners' stories and some of the collaborations and who we do this work with. So we were with SLPS for Professional Development Workday. I got to speak to 70 nurses. We were at the Urban League of Greater St. Louis with our Behavioral Health Bureau to talk about the opioid response. That was an incredible day. Lots of storytelling, a lot of the partners in the region in one place. And we got to celebrate Betty Jean Kerr People's Health Centers and the Amanda Luckett Murphy Hopewell Center completing a historical merger, ribbon cutting there. And there is a living legend in that picture, the Dr. Amanda Luckett, one of the Black women physicians in this area who walked and opened doors so that I could even be in this seat. And you should, if you don't know who Dr. Amanda Luckett is, that's a second part of your homework, is to find out about who she is, why she's important to St. Louis and the region, and what she's done for health and public health in her incredible career. So I will stop there. This was just a primer. Upcoming events, you all always ask me what's coming. So, if you want to hear me on the radio, we've got the streets every Tuesday. We are doing an employment wellness day that includes line dancing and some aerobic exercise for the team. We did a survey, and the overwhelming number of people in the department said that our employment wellness days are one of the things that have really changed their ability to feel seen and supported in the department. So we are keeping them going. It is Alcohol Awareness Month, National Child Abuse Prevention Month, Sexual Assault Awareness and Prevention Month, and Testicular Cancer Awareness Month as well. So we're promoting those. And then we and I will be around the city speaking to the community, and we have the dates for those as well. The biggest thing about April is that it's going to be National Public Health Week in April. Shantae has an incredible lineup. I don't know if she's still on the call, but Shantae, if you are, did you want to give a brief a shout out to, again, Shantae? I don't know if Shantae sleeps with the amount of work she does, but she has configured a National Public Health Week that is super exciting. Do you want to give them a preview, Shantae, of what you're thinking about for this year, what you have?
I have moved you all around. Good morning, everybody. How are you? So we are really excited for National Public Health Week. Dr. Madi, we love you, but you are going to be so busy. We have, I know we have Dr. Madi on television with Great Day St. Louis to kick off National Public Health Week, we're also going to be highlighting our accreditation or reaccreditation. We're going to definitely celebrate that in the spirit of National Public Health Week. And then during the course of the week, Monday through Friday, we're going to launch information about our community health improvement plan. So you'll see 30-second clip commercials that kind of highlight that we do have a new CHIP that's been active for it. Well, it's been a year, so because we're already at the annual report. But anyway, we have a 30-second clip that will be out there. And every day of the week, we will have was it a 60-second clip that will highlight each of the priorities in the community health improvement plan. All of this information that we have out there will also direct people to the St. Louis Partnership for a Healthy Community, and has a barcode where people can go directly to the site so that they can read up on the CHIP, on the different priorities, and the call to action will be for people to get involved. We have also invited, because the St. Louis Partnership for a Healthy Community also includes our friends at St. Louis County Health Department. We're also going to have Dr. Cunningham on air later on during the week, on the day that we highlight the priority of maternal child health. I'm trying to think of what else do we have. We have a radio spot that will be going. Dr. Madi, there's going to be an ask for you too, just to say hello and just to also promote that the community health improvement plan is there. And so, yeah, there's a lot of things going on. Stay tuned. I will definitely send everybody an email that will highlight. There'll be a MailChimp that goes out that highlights everything that you can look for and where you can find either the clips. There's also going to be some printed assets that highlight each of the priority areas that you'll have accessible. And then our social media, as always, it will be highlighting everything as we go through National Public Health Week. So we're very excited, looking forward to it, and happy to share.
Thank you so much, Shantae. This is her baby. If you haven't noticed, Shantae's leadership model has really been centered around educating and making sure you all, the public, understands what this department, but what public health is doing. And so I love this idea. She's never done this before, and she's been working on this for at least half a year. And this is all about educating. If you are a new board member and you're like, man, I kind of understand the reaccreditation process and the committees, I don't quite remember what the priority areas are and who's doing what, that's what this week is for. So when April asks about educational opportunities, this is the educational opportunity week. Every day, Shantae will be highlighting a priority area, leadership opportunity. So this is all about education. It's all about visibility, and it's all about celebrating public health.
Yeah, I just wanted to add that it's the week of April 7th. I'm pretty sure everyone on this call is quite aware, but I just wanted to just clarify that it is the week of April 7th through the 11th. So
thank you so much, Shantae, for all your work, for the team's work. This is going to be a fantastic week. I'm more than happy to be at your beck and call, so you can send all the asks. The person you have to fight the hardest is Anika, so I'm gonna just stay out of her way, and you all can manage the schedule. But and Anika's my assistant. Her and Shantae work so well together to make magic happen. But thank you so much for your leadership for National Public Health Week, Shantae. It's going to be an incredible week of celebration and of learning. And like Shantae said, you will also get a MailChimp so that you can put this all on your calendars. You know what the schedule is, you know when to tune in, and how you can get involved. So that's all I have, unless there's questions about the department updates and what you saw shared on the screen.
When will that be hitting our inboxes?
The monthly report will be today or tomorrow. The MailChimp around National Public Health Week will be in the next 10 days to 2 weeks. Less, maybe, Shantae, correct?
yes.
Yeah, probably in the next week or so.
I look forward to it. And since we've been assigned, homework, I think because our next meeting is April 17th, that will both be a great time to do a recap of the highlights from Public Health Week, as well as to hear what each of us as members of this board were able to attend or do to support that week. So we will make sure that's added in as a dedicated agenda item for April.
Thank you so much, April. If you wouldn't mind, I'd like to make one other announcement and just awareness for everybody in the spirit of transparency. You are all aware that we are in election season, and I think it's important that you understand the implications of what that means. And so the primaries happened a couple of weeks ago. The primaries were open to people being able to vote for more than one candidates. There were 4 candidates. And then what happens is that 2 of the people that get the 2 top votes go into the general election, which is happening soon. The day of the election is April 8th, but I think people can start voting as early as a week before that. So this is like happening now. If you haven't seen the debates, there have been a couple of at least 3 or 4 debates that have been made available, and they're still up live. So St. Louis Public Radio has one that's audio, and then KSDK was last night or the night before, or Tuesday night, and Fox 2 was last week as well. There are still mayoral forums, so if you're looking for opportunities, and we will have on Saturday, March 26th or 29th, March 29th, is going to be a cabinet in the community in South City. So all of the members of cabinet, Mayor Jones will be there, and you can pull up to ask questions. Importantly, you need to understand a few things, is that out of the primaries, the leader for votes coming out of that was Kara Spencer, who's a current alderwoman who got 68% of the votes, I believe. And then Mayor Jones came out with 33 to 35% of the votes, I believe. And so those are the 2 people going into the general elections. I'm getting a lot of questions about what it means if there's a change in leadership. So I want to address that now. If the election, if Mayor Jones comes out as the victor on the April 8th, then it's business as usual. And if Kara Spencer comes out the victor on April 8th, the current administration has 2 weeks to leave office. The transition is very quick. So I think the date is around April 15th or so that the new mayor and their office would be there. It is at the discretion of the new mayor as to who their cabinet is. And I am a cabinet appointee. I serve at the pleasure of the current mayor. I was asked to come in as part of her cabinet. So much like what happens at the federal level, all or some of the directors may or may not be here if there's a new mayor. It is at that discretion to the mayor as to whether she will ask people to stay on or if she's already got other people in play. So because the next board meeting is way after that election and even after the transition, I did not want it to be sudden if there were changes in leadership, both at the mayoral level and even in the Department of Health. And I'm happy to take any questions, but there's not a lot that I can answer outside of what I told you. But I just wanted the board to be aware that this is part of the civic process and the outcome of people voting. I will also note that only 18% of voters in the city voted in the primary election, which is disappointing. We have a lot to do around civic engagement and really understanding why people don't take part in that civic opportunity. And our hope is that April 8th will continue to bring more people out to vote. So please, part of your leadership, all of you are leaders, and certainly on this board, is just to make sure that you engage in the civic process, that you ask the questions that you need, and that you encourage others to vote in the city as well.
Colleen, I see your hand raised.
Yeah, Dr. Mahdi, how does the budget process intersect with potentially a changing administration?
Girl, you know, we all in this together, right? Great question. All I can tell you is that the current budget chair for the Board of Aldermen is the candidate that is also running for mayor in Kara Spencer. So there would be changes there, but the budget process continues. There has to be a city budget that's in place July 1st. So if Mayor Jones is here, it's what I've already described to you. If Kara Spencer is the new mayor, fortunately, she has budget experience being the current budget chair, but it'll be her as part of the board of ENA that would be the voting member, not Mayor Jones, but the budget chair, Paul Payne, will still be the same, I believe. And the comptroller is also up for election right now. That's another voting member of ENA. So you would either have a new comptroller who'd be voting in a new city budget with only being there for a few months, as well as potentially a new mayor. So it could be a mixture of the same folks who've been here, or it could be all new people voting on a process that's already been occurring. I think what's helpful is that all of the city departments have engaged in this budget process. And so I don't, that doesn't get thrown away. It's just who's at the helm of the final decision making could be the same or different.
Dr. Mati, regardless of what happens on April 8th, I think you've made really clear what great public health leadership looks like. As far as what the board should be focused on, I also think it should be focused on great public health standards and practices, things that would not be changing regardless of who the mayor may or may not be. But that is something for the board to be talking about and creating a strategy around as we move forward with our task force. So thank you all for attending today's meeting. We are a minute over time, and I know people have a very busy day or busy rest of their week planned. But as always, just grateful to be in a virtual space with people who care so deeply about public health and about caring for people who are in our region. So with that being said, our next meeting for this board is April 17th. In the interim, I will be reaching out about scheduling a task force meeting that will occur hopefully the first week of April. All right. I hope everyone has a really wonderful rest of their day.